Hi, today I'll be talking about insomnia, what it is, why you might have it, and my personal experiences with it. Insomnia is a sleep disorder that makes it hard to sleep and stay asleep and get quality sleep. You may be waking up too early, you may be waking up in the middle of the night, you might not even be able to sleep at all for like days. Most common causes are stress, anxiety, depression, and pain. And I have a feeling there might be medications out there that may also cause insomnia. But there are like a lot of variations of treatment. Like for therapy, there's light therapy, which is exposure to bright light using a device called a light box, and it mimics sunlight. That's supposed to help. There is a cognitive behavioral therapy, which is just therapy, like talking to people and really trying to figure out why. Because most of the time with insomnia, it's like a mental thing, like you're thinking about too much or stress and all that. So, in general, therapy will help your sleep because you're working through the issues that are keeping you up. And I have had a very up and down relationship with insomnia. When I was like 12, I could go like 2 days without sleeping. Like it was normal. It was absolutely horrendous. Like I'd just be staring at the wall, no music, no lights, just not even thinking. I just couldn't shut the brain off. And for me, a lot of it is stress and pain. Is living with chronic pain. It is very difficult to sleep. And then throughout my teen years, it just has been horrible. Way worse. When I was 16, I think I could go like 3 days no sleep. I don't know how, running on fumes. I'd crash and be asleep for like the next 2 days, but I just couldn't. I had so much in my mind. I was so stressed. I was so much pain at that time too, that even when I was mentally absolutely exhausted, my body would keep me up because it would just not stop. So insomnia has been real close to home. And I do still struggle with it, mostly because of pain. It's still like night and day. For like most nights I can't fall asleep, it just takes longer than most people. Definitely having a sleep habit. I went on like a year long challenge of waking up at 5 a.m. and doing that I had to sleep, and even if I didn't sleep, I'd still wake up at 5. And I also just never had a sleep schedule growing up, so I think that definitely made it harder because I've never had a routine. So trying to create one as an adult is definitely a little more challenging, but totally doable. So like having a sleep schedule that works for you and your own personal internal clock, and no phones and TV does help. Like before bed, it does help. But who's gonna do that? Nobody's gonna do that. I'm not gonna do that. But yeah, no, it does help. Making sure that you take a medication before you go to bed if you have chronic pain, if pain is your issue. But also sleeping pills, if you have a good relationship with them, could be a wonderful thing, like melatonin. So for me, I have a bad habit of not taking sleeping pills before I go to bed because I'm like, I'm gonna be sleeping. Why do I need it? Or like, I forget until I'm like up for 2 hours because my body's calling. I'm like, oh, should have taken that maybe. So if you struggle with that, it's definitely a good thing to be mindful of. And melatonin, I used to be really freaked out with sleeping pills. I don't know why, like, they absolutely terrify me. Maybe it's the anesthesia, but I don't really mind anesthesia. I don't know. They're just creepy. I don't like the feeling like falling asleep. I always feel like I'm gonna die. But once I was like 17, I was like, oh, I don't care anymore. And I took melatonin, and it definitely helps. And I don't take it every night. I take it once in a while if like my pain's not letting up and I just need to sleep. But yeah, no, it could be a great tool. I know ASMR has actually been really wonderful. It can take a while to figure out which triggers are actually for you or actually get you relaxed, because there's so many. But for me, it's really nice, and there is one specific is really cool. So it's like light therapy kind of. So like if you hold your phone up and you have ASMR or even just a video of it, but like flashing lights, and close your eyelids, you will see the flashing lights through your eyes. And for me, it still stimulates my brain to like be comfortable, because I'm not comfortable in stillness and silence. But my eyes are closed and they get heavier and I actually fall asleep. And that was something really cool. And if you're epileptic, don't do that. I think that's the word. If flashing lights make you freak out, don't do it, obviously. But it's really cool to try. But I also have learned what I needed to listen to for sleep. So like if my brain is really, really scattered, like I can't get it to stop running, I will watch something or listen to something really, really upbeat, because it kind of evens out my brain. Because like if I listen to like rain and soothing things when my brain is going 100 miles an hour, I'll just use that as like background music for the horrible scenarios in my head. Like it does not help. But if I'm getting equally distracted in real life, it kind of evens it out, and then I can kind of get tired. Ocean documentaries are a huge thing that really get me to sleep. Finding your niches and learning what your body needs, the best you're gonna get. And I'm definitely an atmospheric person. I need my energies to align in everything. So if my room is a complete disaster, if I feel really claustrophobic in the space I'm in, that will also make it just so much harder to sleep. And I know that my sleep is 10 times better when everything's just clean. My space, the way I like it, makes it easier and makes it easier to relax, like anybody else. And journaling is definitely something that has helped me. Even though it's not fun to do, oh well, it helps. And then sleeping with somebody, like your partner, well, obviously, for most, some people like being alone, some people like their space. They starfish the shit out of the bed. They don't want anyone there. Totally get it. If that's your boat, float it. But it does help, especially if you do kind of have chronic pain. Having somebody else there to, like, if you're having an episode of any sorts, to comfort you, and also just human contact is going to immensely help. And I think that's also, other than like me working through a lot of my stuff mentally and just being in a really good place and learning my symptoms and learning what I need, my boyfriend is a huge help. And my insomnia has, it's there because of my pain. But other than that, like if I really start freaking out in the middle of the night, he's there to help me and just kind of get my body to calm down, because it doesn't feel as heavy because he's helping me hold the weight of like the pain and stuff. So having somebody there for you is always going to be beneficial. And I think insomnia is a harder topic for me to talk about because it's so broad, and insomnia is a serious, horrible feeling. It's usually most commonly caused because you have other issues in your life, and life issues aren't just as easy as like, yeah, journal, just work through it, then you can sleep. It's like, no, that's not how that works. So I never want to just be like, yeah, do this, or don't be lonely and you'll be fine. Like, insomnia is such a difficult, complicated thing. But just knowing that, like, you know, it's a really common struggle and there's different variations of it. And I think being patient with yourself is the best advice I can give, and also just to myself, because I have always just been very frustrated. And it is okay to be frustrated, but there are times where I'm just too hard on myself, and the more frustrated, more angry I get with myself when I just cannot shut off my brain or my body. It makes me stay up even longer, and it makes the process even harder and brain run faster, and it's just not helping. And when I'm patient with myself, I'm like, okay, yeah, I can't sleep right now, but, you know, eventually I'll get there. Be kind. So be kind to yourself is just where I'm trying to get at, because what else are you gonna do? It's not your fault, you know. It happens. I wish we could just flip a switch and go to sleep. That would be amazing. Oh my god. But yeah, and I'm also sure there are like a million tips and tricks, but those are like the basics in general, and like, yeah, it's not fun. But I really do hope you get some sleep, and if you have still struggle with insomnia, or you have been, or like mine, it fluctuates through life, you're not alone. And if you have any tips that make you sleep easier, please share. Heaven knows I need it sometimes. But yeah, hope it's interesting and relatable. But yeah, thank you for listening and watching. Bye!